Morning, everyone. Welcome to Unacademy. Is my voice is audible to everyone? Yes. So today we are going to discuss the drugs which are acting on the ANS, autonomic nervous system, which includes both sympathetic as well as parasympathetic nervous system. So this is the ninth day of our 75 days hard challenge. So with this 75 odd day challenge, you can boost your rank with best top-notch educators in across India. There will be a discussion of quality MCQs. Yeah. So this कल से 20% ऑफर on all GPAT and other pharma exams subscription में होने वाला है, where you will get different types of discounts on various platforms like batches. 1 year का बैच है और 2 years का बैच है GPAT, वैसे भी ESIC फार्मेसिस्ट है, अनलॉक फार्मेसिस्ट है, जो भी स्टेट हो सेंट्रल हो. For that you need to include my code, that is DKSR5. After that you will get the instant 20% discount. ये ऑफर कल से शुरू होने वाला है. That will be last till 26th of this month. अभी तक जो ऐप को डाउनलोड नहीं किया है, go to the Play Store where you can download our Unacademy app. Select the goal GPAT and other Pharma Exams. Go to Store. You can select whatever you want, either GPAT, Pharmacist या DI जो भी, where you can use my code DKSR5 and start learning the course. Yeah. अभी हम क्लास को शुरू करते हैं. So this is the first MCQ which was asked very recently का question है, which was asked in 2023. Fight or flight responses are mediated by. Even this also comes under HAP, Human Anatomy and Physiology. जब हम नर्वस सिस्टम को डिस्कस करते हैं तब हम ये डिस्कस करते हैं, ठीक है. Fight or flight responses are mediated by. ओह बढ़िया बढ़िया. सिंपल क्वेश्चन है. Yes. The correct answer for fight or flight responses are mediated by the, जो सभी लोग बता रहे हैं वो सही है, sympathetic division of ANS. The answer is sympathetic division of ANS. So generally the ANS will have the two divisions. One is sympathetic, the other one is the parasympathetic. Mainly the parasympathetic division of ANS have the rest and digest. The important function of this is we call as the rest and digest बोलते हैं उसको. Whereas for the sympathetic division we call it as the fight or flight. Fight or flight situation बोलते हैं. So this is tackling the stress and an emergency condition. Yes, fear, fight or flight. हाँ भाई, जी पैट में इतना इजी, हाँ इजी क्वेश्चन होता है ना दिग्विजय कश्यप. there will be almost 25 questions will be very easy that everybody can with a minimum knowledge can answer the questions which are asked in the GPAT. Okay. Out of 125, 25 questions will be somewhat easy that can be answered by any student. So this rest and digest means this is the assimilation of food and conservation of energy. The parasympathetic division mainly involves the assimilation of food and conservation of energy. That is the main important function of the parasympathetic nervous system. Whereas sympathetic nervous system, it will be activated, it will be stimulated whenever there is a situation called emergency or stressful conditions में वो तुरंत ही activate हो जाता है. ठीक है. अगला क्वेश्चन देखते हैं हम. ये भी वेरी रीसेंट का क्वेश्चन है. जी पैट 2023 में पूछा गया था. ये भी सिंपल क्वेश्चन है इफ यू नो द बेसिक कॉन्सेप्ट. Yeah, this is asked regarding the muscarinic receptors, their location. Muscarinic receptors, we have the M1, M2, M3, M4, M5, and in this question they have asked the muscarinic receptors का location पूछा गया था. उसमें से कौन सी सही है? Just to give the answer. Yes, Sneha Shri is asking, sir, PhD from Niper is best or from your foreign country? If you want to live in India, better do PhD from the Niper. But if you want to settle in abroad, you can do Niper. You can do your PhD from a good, reputed university, mainly from the US. ठीक है? Yes, everybody is giving the right answers. So as we know that there are the mainly among all the receptors of muscarinic, M1, M2, M3 receptors important. M1, which is called as the neural. M2 is cardiac, whereas M3 glandular, या इसको बोलते हैं स्मूथ मजिल्स. स्मूथ मजिल्स. ठीक है. So this is a location. M1 का मतलब है neural. Otherwise we call it the neural. M2 cardiac. M3 glandular या smooth muscle. So from this you can easily find out the answer. So option A, M1 is receptor confined to brain, ये गलत है. M2 is neural, M3 is cardiac, गलत है ये ऑप्शन. M1 is neural, ठीक है. M2 is cardiac, ये गलत है बी ऑप्शन. M1 is receptors are neural, M2 astragal receptors cardiac, M3 are confined to the glandular. So the correct answer is the C. So this is the answer, correct answer. M1 is glandular, ये भी गलत है, D also गलत. So the right option is M1 neural, M2 cardiac, M3 glandular या smooth muscle. Even if you don't know the M4 also, no problem, because by knowing these different subtypes, we can easily identify the correct answer. M1 Dhanashri, M1 is neural, M2 is cardiac, M3 is glandular या smooth muscle. ठीक है. And why say if you know that इसमें जो ऑड नंबर है, जो ऑड नंबर्ड सब टाइप्स, जैसे M1 है, M3 है, M5 है, if you see the their coupling, they are generally coupled with the G naught protein, where it can activate the IP3 pathway, where it can activate the IP3 inositol triphosphate pathway. But if you see the even numbered subtypes of muscarinic receptors, even number मतलब जैसे M2 होगा, M4 होगा, they are mainly mediated through the GI. I का मतलब वो है they will inhibit the adenylyl cyclase. They will inhibit adenylyl cyclase. ठीक है. So whenever there is inhibition of adenylyl cyclase, ultimately it will inhibit the cyclic AMP levels. That will inhibit the cyclic AMP levels. ठीक है. So orally the odd number, the function is excitatory, whereas the even numbered muscarinic receptors are inhibitory in nature. Inhibitory in nature. ठीक है. Yes, they cause the hyperpolarization. सही है. Then we will see the next question, which was asked in the GPAT 2017. ये भी बहुत easy question है. Anybody can answer this. Acetylcholine is hydrolyzed by which enzyme? Siddhanta Ghosh. Not only M4, M5, all the muscarinic receptors are GPCR receptors. Siddhanta. All the muscarinic receptors belong to the GPCR. Not only M4, M5, all M1, M2, M3 जो जितना भी है, that all are belong to the G protein coupled receptors. ठीक है. Yes, everybody is giving the right answer. Easy है ना. So acetylcholine is hydrolyzed by which enzyme? Acetylcholine, जैसे जैसे acetylcholine is produced, it is easily metabolized or easy hydrolyzed to the choline plus acetate or acetic acid, you can say acetate, by the enzyme acetylcholinesterase. So this is the enzyme acetylcholinesterase. Acetylcholinesterase will metabolize or will hydrolyze the acetylcholine into the choline or acetate. ठीक है. So there are some drugs which will inhibit this acetylcholinesterase. There are some drugs which are called as the anticholinesterases. Anticholinesterases that will inhibit this enzyme. एंटीकोलिनेस्टरेजेस एग्जांपल्स बहुत सारे एग्जांपल्स है. जैसे आपको होगा नियोस्टिग्मिन, पिरिडोस्टिग्मिन, फाइजोस्टिग्मिन, हाइड्रोफोनियम, देयर बहुत सारे एग्जांपल्स है. So this will inhibit the acetylcholinesterase, where it can increase the concentration of ACH. The anticholinesterase drugs will increase the concentration of ACH. So the increased ACH will act upon the nicotinic receptors as well as muscarinic receptors. हाँ, दिग्विजय कश्यप, या इतना इजी क्वेश्चंस भी पूछते हैं भाई, ऐसे मत सोचे कि खाली कठिन क्वेश्चंस पूछते हैं. नो, देयर विल बी सम इजी क्वेश्चंस. यस, फाइजोस्टिग्मिन, रिगोस्टिग्मिन, बहुत सारे हैं. ठीक है. यस, धनश्री, नियोस्टिग्मिन, दोनों रिगोस्टिग्मिन, टैक्रेन, दोनों, यस, बहुत सारे एग्जांपल्स है. वो रिवर्सिबल होगा, इरिवर्सिबल होगा. ठीक है. The Tacrane donopazil rivastigmin that will be mainly used for the treatment of Alzheimer's disease. अगला क्वेश्चन देखते हैं हम. This was asked in the GPAT 2014 में पूछा गया था ये. Which of the which of the following drug is the resistant to both true as well as pseudo cholinesterase enzyme? कौन सी ड्रग है वो मोस्टली रेसिस्टेंट टू द बोथ द ड्रग्स, बोथ द एंजाइम्स, whether it is true or pseudo cholinesterase enzyme. फटाफट दे दो भाई आंसर्स. ए बी धनश्री, अस्टाइल कोलिन. यस, कुणाल सिंह. Which of the following is resistant to both true as well as pseudo cholinesterase enzyme? So the correct answer is the carbachol. कार्बाकॉल और बीथा निकाल भी. अगर बीटा, अगर मान लो कार्बोनिकल नहीं है, अब ऑप्शंस में बीथा निकल है, सो वो भी सही है. कार्बाकॉल एंड बीथा निकाल, बीथा निकाल, both are correct answer. These are resistant to the both true as well as pseudo cholinesterase. Therefore their duration of action will be the longer duration of action have. ठीक है. Acetylcholine, methacholine, pilocarpine, they are not resistant to the cholinesterase enzyme. They are easily hydrolyzed by the cholinesterase enzyme. ठीक है. If you have any doubts or regarding anything, you can ask in the live chat. ठीक है. Very similar question we will see in the next slide, which was asked in the 2013. 2013 का क्वेश्चन है. Which of the following cholinomimetics activates both muscarinic as well as nicotinic receptors? इसका आंसर बता दीजिए. जफीर आलम सर, फास्ट. नो, सभी लोगों को अंडरस्टैंड होना चाहिए ना जफीर. Everybody should get understand the concept. Anyway, we are going to discuss only the 15 questions that we can cover during this duration of 1 hour. ठीक है. Yes, बढ़िया बढ़िया. Everybody giving the right answer. सभी लोग सी बता रहे हैं. Yes, that is the correct answer. So which of the following cholinergic activates both muscarinic as well as nicotinic receptors? The correct answer is the carbachol. This will act upon the muscarinic as well as the nicotinic receptors. ठीक है. Not methacholine, only carbachol. Kunal Singh, only carbachol. The answer is only carbachol. चलो आगे बढ़ते हैं. So this is the question which was asked in the GPAT 2014 में पूछा गया था. Actions and clinical uses of muscarinic cholinergic agonist include which one of the following? मतलब कोलिनोमाइमेटिक्स एगोनिस्ट होगा ना, उसका यूज क्या है? कोलिनोमाइमेटिक्स का यूज क्या है? इन चारों में से कौन सी है जो हम मस्करनिक या कोलिनोमाइमेटिक्स को यूज करते हैं? बताओ फटाफट. सिख, कुणाल सिंह. So whoever is giving the first answers, the top 10 will be in the हमारा लीडर बोर्ड पे होगा, क्लास लीडर बोर्ड पे. कुछ लोग डी डी बता रहे हैं. यस. So actions and clinicals of muscarinic agonist include the, देखते हैं, bronchodilation. The cholinomimetics or the muscarinic agonist will cause the bronchoconstriction. They doesn't cause dilation, बल्कि they cause the bronchoconstriction. So therefore we should not use this muscarinic agonist to the asthma patient because still it will exacerbate the disease. अस्थमा में पहले से ही उनका सांस लेने में थोड़ा मुश्किल रहता है. अगर if you give this colinomimetics, still they feel very much difficulty in taking the ventilation or in taking the in taking the breath, in taking the air. So therefore all the muscarinic agonists should be contraindicated in the asthmatic patients. So this is a wrong. Improved aqueous humor drainage where it can be used for the treatment of glaucoma. This is the correct answer. जैसे we will use the exam important drug is pilocarpine. We will use the pilocarpine drugs or pilocarpine eye drops. Decreased gastrointestinal motility. No, it will increase the gastrointestinal motility. ये भी गलत है. Decreased neuromuscular transmission, relaxation of skeletal muscle relaxation. We should not use this for this drug. This can be used for the NMJ blockers. For the surgical anesthesia, we will use the NMJ blockers. उसका मतलब है peripherally acting skeletal muscle relaxants we use. ठीक है. So the correct answer is B. We will use for the glaucoma. Why we use? Because this will improve the aqueous humor drainage. जो भी ह्यूमर आंख में फॉर्म हो रहा है ना, उसी को बाहर निकाल लेते हैं. So therefore that can have very good beneficial effect on the glaucomatous patients. जिस patients को glaucoma होगा ना, that will be very much beneficial for them. Yeah, this is asked in the GPAT 2018 का question है. Which one of the following is not correct regarding the myasthenia gravis? Which of the following is not correct regarding myasthenia gravis? इसका दे दो फटाफट आंसर्स. नॉट करेक्ट. प्लीज रीड द क्वेश्चन. करेक्ट नहीं पूछ रहे हैं. कौन सी गलत है? नॉट करेक्ट. चारों में तीन सही है, एक गलत है. तुम लोग वो ढूंढना है कौन सी गलत है. Yes, we will see the answer here. So myasthenia gravis is the first point regarding the myasthenia gravis is which is a autoimmune disorder. मतलब the option C is correct. So second point regarding the myasthenia gravis is which will have the down regulation of nicotinic receptors, which means it will produce the antibodies that will act at the NM receptors, nicotinic receptors, especially the NM receptors. Down regulation madlam there is a decreased synthesis of nicotinic receptors. And the third, if you see the treatment options for myasthenia gravis, therapy for the myasthenia gravis, the first option we can use the yes treatment we can use the anticholinesterase drugs. जैसे धनश्री ने बता रहे हैं, we will use the anticholinesterases. ठीक है, this will be the first option. जैसे neostigmine, predostigmine, edrophone we will use. Second option, we can also give thymectomy. You can see the option D. Thymectomy is also correct. Thymectomy is the one option. Thymectomy, which will be very much useful those who have the thymoma. Thymoma मतलब है a tumor of thymus gland. Tumor of thymus gland is called as the thymoma. So this thymoma can be treated by surgically removing this thymoma can be a very good option in case of myasthenia gravis, which means option D is correct. Thymectomy is the best treatment, or you can say it's a one of the treatment option for myasthenia gravis, which is also correct. Okay? The treatment the third drug we will use is the because it is an autoimmune disorder. Because it is an autoimmune disorder, we have to treat the autoimmune disorders by giving the immunosuppressant drugs. Immunosuppressant drugs. ठीक है, जैसे we will also give the glucocorticoids. We will use the different glucocorticoids because the glucocorticoids are the important immunosuppressant drugs. ठीक है, so we will not use tuberculin in the treatment of myasthenia gravis. So this is the answer. ये हमारा आंसर है. ठीक है, चलो फिर आगे बढ़ते हैं. So this is asked in the AIIMS 2015. ये एम्स का क्वेश्चन है, 2015 में पूछा गया था. Organophosphates act by inhibiting the enzyme acetylcholinesterase. ये तो आपको पता है. आपको पता है. So which type of enzyme inhibitors are they? Organophosphates act by inhibiting the enzyme acetylcholinesterase. So which type of enzyme inhibitors are they? चलो बी बता रहा है. हम्म. So in the classification itself, we will study anticholinesterase are reversible inhibitors, irreversible inhibitors. So in the irreversible inhibitors, we study organophosphates. So the first option is that they are the irreversible. एक तो हमको मालूम है they are the irreversible, but at the same time they act competitively. They act or they inhibit competitively the enzyme acetylcholinesterase. So the answer is competitive and irreversible. Competitive and so organophosphates competitively and irreversibly inhibit the enzyme acetylcholinesterase. ठीक है. So इसलिए whenever we are studying, yes, there is a chance. We will see the next question. Ninth question, which was also asked in the AIMS 2018 का question है. Mechanism of action of prolid enzyme. We call it as the two palm, two prolid enzyme. What is the mechanism of action of this drug? बता दीजिए. First tell me what is the use of this drug, why we use this drug. बताओ, what is the use of this prolid enzyme, what is the category of this drug. You type in the live chat box what is the use of this prolid enzyme, two palm, then you can give the answer. इसका यूज क्या है, प्रोलॉक्सम का यूज का? न्यूरोमस्कुलर पैरालिसिस, नो. आफ्टर सर्जरी, नो नो. नहीं है. यस, प्रतिभा विश्वकर्मा. So this drug is the antidote for OP poisoning. We can say this is the antidote for OP poisoning. Organophosphorus poisoning का एंटीडोट है. ठीक है. Yes, सिद्धांता घोष, you're right. So this is used for the treatment of as an antidote for OP poison. OP poison we will give two drugs. One is atropine. The second drug we are going to give is the prolidoxime. So this prolidoxime mechanism is it will reactivate the acetylcholinesterase enzyme. So the correct answer is it will reactivate the acetylcholinesterase enzyme. Okay. So most of the farmers across India easily they will commit suicide by taking this organophosphorus poison. मतलब जो insecticides रहते हैं ना, insecticides and pesticides. The important ingredient in insecticides and pesticides is the organophosphorus poison. So whenever they consume by committing suicide, आत्महत्या करने के लिए जो किसान यूज करते हैं ना, उसको कैसा सेव करेंगे? तुरंत ही we have to give these drugs either atropine and also we can give this to palm. जल्दी ही जल्दी देना चाहिए. ठीक है. चलो फिर we'll proceed to next question. ये भी एम्स का क्वेश्चन है which was asked in the 2015. Which one of the following statement is false? Which of the following statement is false? Yes, ज्यादा सही उत्तर दे रहे हैं. Yes, बढ़िया बढ़िया, सभी लोग सही उत्तर दे रहे हैं. Yes, we'll see. Which of the following statement is false? Neostigmine is a quaternary ammonium compound. It is a correct one. Neostigmine a quaternary ammonium compound है. Because they are the synthetic compounds. They are the quaternary ammonium compounds है. Botulinum toxin increases the ACH release. So this is wrong. Wrong है. Botulinum toxin decreases the ACH release. The correct option is botulinum. जो भी botulinum toxin या बुंगारो toxin बोलते हैं, दूसरा toxin है बुंगारो toxin. These toxins will decrease the ACH release. Acetylcholine release को रोक लेता है. Especially there is a process called as exocytosis. Exocytosis को रोक लेता है. It will inhibit the exocytosis, which means there is a decreased release of ACH from its stores or its vesicles. Prolidoxime reactivates acetylcholinesterase. Just पिछले स्लाइड में पिछले क्वेश्चन में हम देखे थे. This is the right answer. Organophosphates inhibits acetylcholinesterase. AB. Organophosphates competitively and irreversibly inhibits acetylcholinesterase. AB sahi hai. So the correct answer is botulinum toxin increases the ACH release. So this is the wrong answer, which will decrease the ACH release. ठीक है? ये लाइट चला गया. Yeah. So the next question is, which is also in the AIIMS 2012 में पूछा गया था, 13 में पूछा गया था, 14 में भी पूछा गया था. सेम क्वेश्चन वाज रिपीटेड. Cholinomimetics are useful in all of the following conditions except. यस, सभी लोग सही उत्तर दे रहे हैं. यस, बढ़िया. गुड गुड. Yeah. So you'll see cholinomimetics can be used for the treatment of glaucoma. ये भी सही है. Will also be used for the myasthenia gravis. ये भी सही है. These cholinomimetics are useful for the post-operative urinary retention. So it is also right. So these cholinomimetics are not used for the bradycardia. ठीक है? Actually, the cholinomimetics will induce the bradycardia. The cholinomimetics will have the side effect or will have important action in the heart is they cause the bradycardia. Therefore, we call them as they cause the negative chronotropic effect drugs. इसके वजह से what we call them? They call as negative chronotropics or negative chronotropic agents. ठीक है? Yeah. So this question is asked in the GPAT 2012 में पूछा गया था. Which of the following class of drugs cause side effects? जैसे ड्राइनेस ऑफ माउथ, टैकिकार्डिया, यूरिनरी रिटेंशन, कॉन्स्टिपेशन, blurring of vision, precipitation of glaucoma, drowsiness, impairment of cognition. बहुत सारे क्लूज दिया है. इतने सारे क्लूज देने की भी जरूरत नहीं है. इसमें दो तीन अगर दिया तो भी हम आंसर कर पाएंगे. Which is also a very easy question which was asked in GPAT 2012 में पूछा था. Yes. So the answer is anticholinergic drugs or anti-muscarinics. Like the prototype drug is atropine. The atropine, which are called as the atropine-like effects. Atropine-like effects. We call these effects as atropine-like effects. So like dryness of mouth होगा, tachycardia होगा, urinary retention होगा, constipation होगा. These all we have in the anticholinergics. ठीक है? Yeah. This is question in GPAT 2020 में पूछा गया था. Nicotinic action of ACH is blocked by. Nicotinic action of ACH is blocked by. कुछ लोग ऑप्शन सी भी बता रहे हैं. Yes. So the nicotinic action of ACH is blocked by the D-tuberculin. In short, we call as the DTC or D-tuberculin. ठीक है? So this D-tuberculin is a NMJ blocker, or it can used as a peripherally acting skeletal muscle relaxants. Yeah, these are the NMJ blocker है. ठीक है? Yeah. The same question, you can say it is a repetition question. D-tuberculin produces skeletal muscle relaxations by inhibiting. By inhibiting. It was asked in a different way. Same question was repeated. So you know that we already studied that this comes under the peripherally acting skeletal muscle relaxants. Peripherally acting skeletal muscle relaxants. So, muscle relaxants are two types. One is peripherally acting, the other one is the centrally acting. These peripherally acting muscle relaxants can be used during the surgical procedures in order to paralyze the skeletal muscles. In order to paralyze the skeletal muscles, we will use this peripherally acting skeletal muscle relaxants, especially during the anesthesia, especially during the surgery procedures. But whereas centrally acting muscle relaxants are used to treat the spasticity which is associated with the मसल पेन. सो मसल पेन अगर जब भी अगर तुमको बैक पेन होगा, वो बैक पेन को और कुछ मसल स्पैजम्स को कम करने के लिए we will use the centrally acting muscle relaxants. So these are the peripherally acting, mainly comes NMJ blockers, neuromuscular junction blockers है. These neuromuscular junction blockers can be of two types, as we know that non depolarizing होगा, ठीक है, डीपोलराइजिंग भी होगा, डीपोलराइजिंग ब्लॉकर्स. नॉन डीपोलराइजिंग का मेन एग्जांपल इज डीटीसी, डी ट्यूबेकुलरिन, पैंकुरोनियम, वेकुरोनियम, मिवाकुरियम. all the curiums will comes under non depolarizing, whereas depolarizing blockers only एक ही एग्जांपल है, that is succinylcholine, or it can also be called as the suxamethonium. Succinylcholine, it can also be called as suxamethonium. ठीक है. So D-tuberculin produce skeletal muscle relaxations by inhibiting the nicotinic receptors. The answer is nicotinic receptors in neuromuscular junction. In it is a NMJ, neuromuscular junction. So this is the right answer. Yeah. So the last question of today's session is, which is the asked in AIIMS 2017 में पूछा गया था. ये सिंपल का क्वेश्चन है, बट सब ट्रिकी क्वेश्चन है. Which is not a endogenous catecholamine? Which of the following is not an endogenous catecholamine? बता दीजिए फटाफट. Yes, everybody is giving the correct answer. Yes. So the catecholamines, there are various endogenous catecholamines. You know that the molecules, the substances which contain the catechol moiety is called as the will comes under catecholamines. So जहां पर भी catechol का moiety होगा ना, this is a catechol moiety, the benzene ring where it contains OH hydroxy group side पे रहेगा OH, which is called as the catechol moiety. So wherever it contains the catechol moiety, that are called as the catecholamines. ठीक है. So generally there are important three endogenous catecholamines are present in the body. One is noradrenaline, adrenaline, noradrenaline, adrenaline, or dopamine. Dopamine. These are the three important endogenous catecholamines. ठीक है? So the answer here is dopamine catecholamine है, adrenaline भी catecholamine है, non-adrenaline भी catecholamine है. The answer is the dobutamine is the not endogenous catecholamine. Dobutamine is also a catecholamine, but is not the endogenous catecholamine. This is not the endogenous catecholamine. We can say it is an exogenous catecholamine. Exogenous catecholamine. ठीक है? So what's the starting material for the synthesis of catecholamines? What is the main precursors for the biosynthesis of catecholamines? Just you can give your answer in the live chat. What is the starting material for the synthesis of catecholamines? No? Yes, Kunal Singh, Subhoj, yes, Subhojit Pal. So the tyrosine is the starting precursor. From the tyrosine, they will produce the dopa. From dopa, dopamine. And from dopamine, noradrenaline. And from noradrenaline, they will synthesize the adrenaline. Okay? So the starting material is the tyrosine. खुशबू कुमार, yes, direct skeletal muscle relaxant is the dantrolene. Yes, correct है. Direct skeletal muscle relaxant is the dantrolene. खुशबू कुमारी, you are right. So कल से ये ऑफर शुरू होने वाला है. 20% ऑफर you will get once you use my referral code DKSIR5. So if you apply my code, instantly you will get the 20% discount offer. Whether it is in the 1 year GPAT batch or 2 years GPAT batch. So for 1 year it will be around 3,599. For the 2 years, those who are in the second year, third, मतलब जो लोग भी फोर्थ सेमिस्टर है, फिफ्थ सेमिस्टर में हो या सिक्स सेमिस्टर हो, यू कैन चूज द 2 years course for the GPAT where you can write your exam. GPAT 2025 में तुम लोग एग्जाम लिख सकते हो. ठीक है? वैसे भी ESI फार्म्स का भी those who are already applied can join our course. This is very very affordable. You can join our course below 2000. You cannot find these very affordable prices if you compare the other things. You cannot find this much affordable prices when you compare with the other things. And also you have the pharmacist batches, both for the state or central pharmacist. You can join this course at 2399. For that you need to enter my code DKSIR5. ठीक है? Yeah. Those who are not yet download our app Unacademy, you can go to Play Store. You can download after giving your credentials like your name, mail ID, or mobile number. You can subscribe. After that, you can select the goal GPAT and other pharma exams. Go to store tab जो नीचे रहेगा, where you can select the different batches. आपको रहेगा GPAT का या pharmacist का, जो भी हो, drug inspector का. So before joining the course, you will be asked to enter the referral code, where you have to enter my code DKSIR5. Then you can start learning the course. ठीक है? हमारा YouTube चैनल है जो अभी लाइव चल रहा है. यू कैन लाइक एंड शेयर अवर चैनल. वैसे हमारा टेलीग्राम चैनल भी है. इन टेलीग्राम चैनल यू हैव टू टाइप and at the rate of Unacademy and Pharma, where you can find our Telegram channel also. Thank you. So if you have any doubts, you can ask. Otherwise, we will end the class here itself. If you have any doubts, you can ask. Thank you.